How to treat coronavirus symptoms at home. There is currently no specific treatment for coronavirus COVID-19, but you can often ease the symptoms at home until you recover. Treating a high temperature. If you have a high temperature, it can help to get lots of rest. Drink plenty of fluids, water is best to avoid dehydration, drink enough so your pee is light yellow and clear. Take paracetamol or ibuprofen if you feel uncomfortable. Is it safe to take ibuprofen if I have symptoms of coronavirus? Treating a cough. If you have a cough, it's best to avoid lying on your back. Lie on your side or sit upright instead. To help ease a cough, try having a teaspoon of honey. But do not give honey to babies under 12 months. If this does not help, you could contact a pharmacist for advice about cough treatments. Information. Do not go to a pharmacy in person. If you or someone you live with has coronavirus symptoms, you must all stay at home. Try calling or contacting the pharmacy online instead. Things to try if you're feeling breathless. If you're feeling breathless, it can help to keep your room cool. Try turning the heating down or opening a window. Do not use a fan as it may spread the virus. You could also try breathing slowly in through your nose and out through your mouth, with your lips together like you're gently blowing out a candle. Sitting upright in a chair. Relaxing your shoulders, so you're not hunched. Leaning forward slightly, support yourself by putting your hands on your knees or on something stable like a chair. Try not to panic if you're feeling breathless. This can make it worse. How to avoid spreading coronavirus to people you live with. If you are self-isolating because of coronavirus, there are things you can do to reduce the chances of spreading any infection to the people you live with. Try to stay away from people you live with. If you have symptoms, you should stay away from other people you live with as much as possible. If you can, stay on your own in one room as much as possible and keep the door closed. Avoid using shared spaces, such as the kitchen, at the same time as other people. Eat your meals in your room. Use a separate bathroom, otherwise, use the bathroom after everyone else and clean it each time you use it, for example, by wiping the surfaces you've touched. How to reduce the spread of infection in your home. Do. Wash your hands with soap and water often, for at least 20 seconds. Use hand sanitizer gel if soap and water are not available. Cover your mouth and nose with a tissue or your sleeve, not your hands, when you cough or sneeze. Put used tissues in the bin immediately and wash your hands afterwards. Clean objects and surfaces you touch often, such as door handles, kettles and phones, using your regular cleaning products. Consider wearing a face covering when in shared spaces. Keep windows open in the room you're staying in and shared spaces as much as possible. Do not share towels, including hand towels and tea towels. If you live with someone at higher risk from coronavirus, it's especially important to try to avoid spreading the infection to anyone who's at higher risk from coronavirus, such as people who are 70 or over, pregnant or have a weakened immune system. If you live with someone at higher risk, try to arrange for them to stay with friends or family while you're self-isolating. If you have to stay at home together, try to keep 2 meters 3 steps away from each other. If possible, try not to share a bed.